The autonomic nervous system is composed of the sympathetic and parasympathetic systems. There is a constant input from these systems that vary from second to second. Sympathetic impulses drive the heart rate to increase, while parasympathetic impulses have the opposite effect. The autonomic nervous system is sensitive to hypoxia at a critical level for the fetus, and changes in this response are therefore used as important indicators of fetal well-being. The sympathetic and parasympathetic systems mature at slightly different rates with respect to gestational age. The sympathetic system matures faster, and this results in marginally faster baselines in the preterm period. Normal baseline variability suggests good autonomic control and therefore little likelihood of hypoxia. In preterm infants, the sympathetic is more mature, so they will have less variability. The medulla oblongata is responsible for the parasympathetic and sympathetic coordination. In a healthy, full-term fetus, the sympathetic and parasympathetic systems are mature and fight all of the time. This is what gives long-term variability on a tracing. Autonomic nervous system balance is due to a well-oxygenated brainstem. The electronic fetal monitor tracing will show moderate variability and a normal baseline with periodic accelerations. The parasympathetic nervous system consists primarily of the vagus nerve, which originates in the medulla oblongata. Fibers from this nerve supply the SA node and also the AV node. Stimulation of the vagus nerve results in a decrease in heart rate in a normal fetus because of vagal influence on the SA node, which decreases its rate of firing and decreases the rate of transmission of impulses from the atrium to the ventricle. The vagus nerve is also responsible for the transmission of impulses that cause beat-to-beat variability of the fetal heart rate. The vagal tone is not necessarily constant. Its influence increases with gestational age. Vagal activity increases as much as 4-fold during acute hypoxia. Anything that causes pressure on the dura surrounding the brain triggers the vagal nerve to cause a decrease in fetal heart rate. So this is why you get a decrease in the fetal heart rate during a vaginal exam. If the anterior fontanelle is pushed on, the decrease is approximately 31 beats per minute. If the posterior fontanelle is pushed on, the decrease is approximately 20 beats per minute. During the second stage of labor, when a baby is flexed up and the posterior fontanelle is getting the pressure, it is normal to see a decrease of 20 beats per minute in the baseline. Vacuum and forceps will lower the fetal heart rate even more if the vagal nerve is intact. The sympathetic nervous system matures earlier than the parasympathetic. It increases the contractility of the heart and increases the fetal heart rate, which increases cardiac output. Where the heart rate goes, so does the blood pressure in the fetus. So if the heart rate increases, the blood pressure increases. The sympathetic nerves are a reserve mechanism to improve the pumping activity of the heart during intermittent stressful situations. The sympathetic nervous system is responsible for accelerations seen on your fetal tracing. If the sympathetic overrides the parasympathetic, then you will see more accelerations, more long-term variability. This variability may almost be marked. The fetus will also have an increased heart rate. If the parasympathetic system overrides the sympathetic system, then you will see fewer accelerations and a lower heart rate. Both the sympathetic and parasympathetic responses require oxygen to function optimally. The goal of chemoreceptors and baroreceptors is to maintain homeostasis. They use the sympathetic and parasympathetic responses to accomplish this. Chemoreceptors are nerve clusters on certain blood vessel walls that are able to detect changes in the chemical makeup of the blood, such as a decrease in the oxygen level, a decrease in the pH of the blood, or an increase in carbon dioxide level as it passes through. Responses depend on what set of chemoreceptors you have stimulated. Peripheral stimulated when low oxygen levels are detected. They check with the brain. If the brain is still okay, then the peripheral chemoreceptors stimulate a parasympathetic response, which slows down the heart and metabolic rates to save oxygen molecules and energy for the brain. When the central are stimulated, the brain is not getting enough oxygen. It acts as a fire alarm which needs an immediate response, causing sympathetic response to increase the heart rate, thereby increasing blood to the brain. This will also cause a catecholamine release. The baroreceptors are also groups of nerve clusters. These work by sensing a change in the diameter of the blood vessel walls. A large diameter of the blood vessel is due to a decline in blood pressure, which stretches the vascular wall. This stimulates the baroreceptors, causing an increase in the sympathetic stimulation of the heart, which causes an increase in the heart rate and promotes vasoconstriction, resulting in an increased blood pressure. A smaller diameter of the blood vessel is due to an increase in blood pressure. The baroreceptors are stimulated and higher blood pressure is sensed, causing an increase in the parasympathetic stimulation of the heart. This causes the heart rate to decrease and contractility to decrease, resulting in vasodilation and a decrease in blood pressure. The baroreceptors in the carotid sinus are responsible for the regulation of the blood pressure in the brain, while those in the aortic arch are responsible for regulation of systemic blood pressure. Before 35 weeks, the fetus is not good at supporting its own blood pressure due to a lack of baroreceptors. Anytime you have anaerobic metabolism, there is a buildup of lactic acid in the environment. If this lactic acid is around the brain, then it will decrease the contractility of the heart. Lactic acid also decreases the effectiveness of the vagal nerve. In the presence of lactic acid, the coordination of the medulla oblongata doesn't work as well, so sympathetic and parasympathetic responses are less effective. Lactic acid also takes a long time to get rid of. You could stop contractions and reoxygenate the fetus, but your fetal heart rate will still not be where you want it to be due to the lactic acid. The fetus can get rid of 4.4% lactic acid per minute. After 10 minutes of intrauterine resuscitation, you will slowly regain variability and accelerations.